Hi everyone, it's Antoinette Carlson, or Ann for short. I'm going to apologize before I go any farther because I've had some gross allergy thing all week. So to me, I sound really, really stuffy and just gross. Maybe that won't come through the video. Hopefully it doesn't. But if it does, I apologize. And I'm going to do my best for this video. This video is part two of the condition presentation that Lovely and I put together. And our presentation, as you know by now, is neurocognitive disorders as a result of traumatic brain injuries, or TBIs. For this part of the presentation, I had to pick an article that covered the topic and that I thought was interesting. And I found the one that's on the slide here, Traumatic Brain Injury, a Disease Process, Not an Event. Now, this article it addresses traumatic brain injuries in a way that I had never really considered. It made a lot of sense once I read it, but it's just never something that I would have thought of my own, I guess. And it offered a lot of statistics that really show how big of an issue this is. So, to jump right in, well, before we actually get to the article itself, I wanted to briefly go over the authors. As you can see, they're both professors at the University of Texas Medical Branch. Dr. Maisel, he was the medical director of the Brain Injury Association of America. And I didn't list them all here, but he received many honors and awards, such as the Clinical Innovations Award from the North America Brain Injury Association, the Lifetime Achievement Award from the Brain Injury Association of Texas. He won Physician of the Year from the Texas Rehabilitation Association, and he also won awards from the Brain Injury Association of America. And Dr. DeWitt, he was a professor of anesthesiology, and it was a bit harder to find information on him in regards to if he won any awards or not. But you can see here that he's contributed to well over 100 articles, all concerning brain injury. So these are both just very incredibly intelligent guys, and they had a lot of interesting things to say in this article. And they start out by explaining that the current way insurance companies view victims of traumatic brain injuries, they view the TBI itself as an event being an end result, a final outcome, a singular thing, sort of like breaking a bone, kind of. Like you broke your bone, it happened, you'll be fine, you just need a cast for a few weeks and everything's going to go back to normal. And the authors argue that this really is not an appropriate way to view traumatic brain injury. They think it's much more appropriate to consider it as a chronic disease. And a chronic disease, they list the 4 criteria for that listed by the World Health Organization. And those 4 criteria, you can see them here, are that the disease is permanent, it's caused by non-reversible alterations, it requires special training for rehab, and it may require long-term observation or care. To really back up their viewpoint that traumatic brain injuries are more fitting as chronic diseases, they spend the rest of the article going through just some crazy statistics. Starting here, you can see that overall, TBIs increase long-term mortality rates and reduce overall life expectancy. Just skimming the slides, the numbers are really crazy. They're very scary, actually. Individuals they're 7 times more likely to die within 15 months of discharge compared to the general U.S. population without head injuries. And individuals who make it past that point, then they're still not that well off, because here you can see that they're 22 to 37 times more likely to die from seizures, 4 times more likely to die from pneumonia, 49 times more likely to die from aspiration pneumonia, which is like the inhalation of toxic chemicals, 3 times more likely to die by suicide, and they're even more likely to die of digestive disorders, which I did not really expect. Something I do want to address quickly is that you can see here that some of the statistics seem to vary. Like up here where it says that 22 to 37 times are more likely to die from seizures, that changes based on the severity of the head injury. If you had a more moderate head injury, you'd be closer to the 22 times more likely to die. But if you had a very severe head injury, it would go up towards the 37. And I just wanted to cover that briefly, since When I first read the article, I didn't understand why it was changing, and also because it's something you're going to see on the following slide, like right here, where they talked about how traumatic brain injuries could also contribute to many disorders and diseases. I'll let you skim these. There's just a few that I'm going to pick out here, but you can see it's just, as I said before, it's just crazy. It's things that you would not expect from a head injury. Like before taking on this project, I assumed that Alzheimer's or Parkinson's, I thought they were all genetic, but this studies have shown that people who have had TBIs are at a higher risk for developing, so there might be some sort of connection there. And on the term of other neurocognitive disorders, you can see here that there are mood disorders. You can develop anxiety, psychotic disorders, OCD, depression. A lot of that, the article said, it seems to really depend what part of the brain was injured in the accident. But still, you can see how someone's whole behavior can change, their whole outlook, their whole life can change from one of these accidents. And something else I want to cover briefly is you can see one of these bullet points talks about how TBI patients show gradual cognitive decline post-injury. Now, that sounds scary, like it's going to happen no matter what. But the research shows that having early intervention can really make you a lot better off than if you received late intervention or no intervention at all. The individuals who got early intervention, they were doing much, much better than their cohort that did not receive that sort of help. And I wanted to touch on that because early intervention is something that we've talked about a lot so far in this class and in this program overall. The fact that being aware and getting resources to people early, it can really make a huge difference in the long run. Something that we definitely shouldn't forget. But now these authors have definitely shown how these brain injuries can carry on into the long term past the singular event that caused the brain injury. And as they said before, this really contrasts with the current views of the insurance companies who see it as a singular event. And now instead of the broken bone example, now they kind of equate it to cancer survivors. When someone's in remission or the cancer's gone, then we kind of adopt this mindset of they beat it. They beat the cancer and it's gone. And to consider people with traumatic brain injuries as brain injury survivors may not really do them justice because we're kind of doing the same thing where it's like the brain injury, it's done. You beat it, you're over it, you're healed now. But are they? Like, they've recovered a little bit, maybe as much as they can, but there's still ways that they're going to be affected that they might not even know or that people wouldn't even really consider unless you sit down and look at all this research that was presented. So overall, the best way that we can help people who have suffered these injuries is to focus on treating the patient with the disease instead of treating the disease in the patient and treating it as it's like something separate from the patient. That's not the best way to approach this because we're not really trying to cure it or wipe the slate clean. What we're trying to do is help patients to live the best possible lives that they can. And the authors argue that if we can get insurance companies, amongst others, to kind of adopt more of this mindset, then there'll be a better foundation for research going out, more preventative measures, and there'll be more awareness of the resources that are there to help. And that kind of leads into the second part. I've pulled up 5 resources for traumatic brain injuries that I want to discuss a little bit about. The first one is the Brain Injury Association of America. And this resource, I kind of take it as it's more of like getting advocates and finding brain injury awareness campaigns near you or nurses near you, professionals near you that can really help you out. It seems to be more of that first step that you take once you believe that you have a traumatic brain injury or that you can receive help from that or that you just need help from it. This seems like one of the first places that you would go for that. The second resource I have is the Brain Trauma Foundation, and this website's kind of incredible. I was just reading this nonstop when I pulled it up. They have these guidelines here. And in these guidelines, they outline almost, you can see this big index, they outline a lot of the therapies that are used for individuals with traumatic brain injuries. Like if I click on ventilation therapies here, just skimming it, you can see whether or not there is sufficient evidence. You can see like details of the therapies. Like I can't even pronounce some of these things. But it says whether or not they meet standards, if they're seen as helpful. Like someone can come on this website and get a really good idea of what may or may not work for them. Like maybe something was suggested to them and they don't think it's right. Well, now they can go on here and they can check and see if it is. The third resource I have is Brainline. This is just more informational. Something I liked about this website was down here you can see the headline section where they update it every day. So if there's a new news article about traumatic brain injury, you're going to get it that day. It's going to be right here, which is really cool if you're trying to stay up to date on something, especially right here you see concussion laws. Keeping up with laws and like anything sort of policy, this website's going to be really helpful to do that with. Here is the National Resource Center for Traumatic Brain Injury. My favorite part, I already clicked on it here, is Chat with Pat. Now, it's kind of like a podcast where you can send your questions into this individual and they will make a podcast and they'll speak about it. They'll speak about the issue in detail. Right here it says that they're very compassionate and they give practical advice, which they are and which they do. And that's got to be super, super nice for people who, it can get really tiring to just read all sorts of stuff about traumatic brain injuries. Like if you saw the PowerPoint I just did, all those statistics, that'd be very, very frightening. So just to hear from another individual, like to hear someone talk about it in a more real way, that has to be super helpful. And the last resource I have here is the Brain Injury Alliance. And this seems to be more of raising awareness. Like there's things here, it lets you know what events are going on in the US. Like if there's certain days devoted to certain aspects of traumatic brain injuries, you can become a member down here, and that would be like if you're in school and you want to have some sort of like awareness walk or presentation about traumatic brain injury, this would be the website you go to. And they also have a lot of informational webinars under their events. You can see a lot of those without being a member, but membership allows you to like host them and so on. So those are all super, super helpful resources. Just overall, it was really kind of fascinating to read about this stuff because this is something that I knew very little about. That's why I picked this topic, because I thought this was a very good way to like just get into it and learn more about it. And I was really surprised at what I did learn. Overall, I really enjoyed working on this project. I've enjoyed putting it together with my partner. I've really enjoyed the class overall, the program, like just everything. I've just been having a great time. And I'm super, super excited to see what everyone else has going for their project. So thank you for listening to this, even with my stuffy voice and all. And again, I'm really excited to see what you guys have been up to. Thank you. Bye.